Jim, question for you. So you've got, I'm sure at the beginning the implementation is always hard, the cultural challenges. You're 7 years into it now. I go back to especially frontline employees. They think of things different. I think everybody in this room understands why we're doing this. Benefits, at least for me, have always been every year it's paying. Nobody wants to be in the orientation, the training. You're 7 years in now. Is it still a cultural challenge above just benefits are always difficult, or is it starting to normalize with the employees that are used to that?
Yeah, I think always a challenge, always an uphill battle. Say, not necessarily defending, but pitching the benefits of why we chose what we chose. Right? It's like, hey, what's that?
Nobody wants to be in the first place.
Right, and it's like even back to the primary care, it's like it's hard to get people to go to the doctor, before they absolutely need to go to an ER visit. So I think the it's softened over a 7-year period because we're getting good results from the employee experience side. And that's where, there's employer costs and employee experience. And we really have, on the employee experience, we have enough stories and there really is a trust there within our organization to make that first call to Simple Benefits as opposed to the 1-800 number on the back. And I think once you're walked through a tough medical situation once, you see that benefit. Like, I think it just takes one time. And I think people, especially on the prescription side, people are very, very sensitive when you change the prescription policy or you mess with what they think they're going to get from a prescription drugs. That we saw early on was really like the hair on fire, and we had to really encourage people, call the team. They will help you work this out while you're at the pharmacy. Let's get this solved.